Hey guys, Dr. Jan Lefkowitz here. Today I'm going to talk about an very important topic, something that is very near and dear to me only because I was a baseball player when I was younger, and I had many shoulder problems that took me years to figure out. So I want to save you the trouble because there's a very overlooked cause of shoulder problems, and it's not a muscular issue in this scenario. This is something that is often overlooked, and it has to do with your body's alignment. That's why I'm holding the spine over here. But most people think of a shoulder problem as just being a shoulder problem, right? But here's the deal. What a lot of people don't realize is the shoulder is connected to the shoulder blade, right? Seems obvious, but most people don't really think about it unless they have studied anatomy. But the shoulder blade sits right on top of the rib cage right here, okay? So keep that in mind. Now the shoulder blade sets the foundation for the actual shoulder. This is the head of the shoulder, the head of the humerus. Now, if you have a nice smooth surface here, a nice flat surface, then the shoulder blade has a nice foundation where it can easily slide and hold its position properly. But now let's say you see these ribs that are coming around and connecting to your spine. Let's just say there's a misalignment in one of these ribs, okay? And that happens. That happens all the time. Why would a rib misalignment happen? It doesn't mean it's dislocated, but the rib cage will compensate based on what the pelvis is doing. So pelvis being down here, if you have an imbalance of your pelvis, the body's not gonna want to walk around crooked, so it's gonna compensate. And from my experience, I've realized that the rib cage does a lot of that compensation. It shifts and it twists, and sometimes one little rib will actually stick out. You can actually feel it. It's something you can very much feel. So if there's a misalignment here, and that's preventing the shoulder blade from keeping in position, like the body's gonna take the path of least resistance every time. So if there's something resisting here, your shoulder blade, instead of sitting back here, it's gonna hang out here, okay? Some people call that winging. Why? Because sometimes it even looks like the shoulder blade is sticking out like a wing. Just a funny term that we call it. But if that happens, you're gonna have a very unstable shoulder. And I don't care how many TheraBand exercises that you've been given, maybe by your physical therapist or your chiropractor, that's focusing on the rotator cuff. The rotator cuff are the muscles that hold the actual ball and socket, so to speak, in place. I don't care how many of those exercises you're doing. If the thing that the shoulder attaches to, the shoulder blade, is out of position, then the shoulder does not have a stable base, and the shoulder will never function properly. Okay, now the outcome of that can be all sorts of problems. You may have a rotator cuff tear. You may have pain maybe in the front of the shoulder, which is actually where the biceps tendon runs in. The biceps tendon connects into the rotator cuff. So there's so many areas that can get inflamed if the shoulder blade's not in position. So how do you fix that? Well, you can't treat the shoulder pain like it's a shoulder problem. You have to treat it like it's a full body problem. Okay, if there's a pelvic misalignment, gotta fix it. How do we do that? We have adjustments that do that. If there's ribs that are out of alignment and that rib cage is out of alignment, affecting the position of the shoulder blade, we got to fix that. So we have adjustments that handle that. Also have exercises that you'll probably have to do, because oftentimes the posture, when people have a slumped posture, again, affects the position of the shoulder blade. All these things have to be fixed in a holistic way. Holistic just means full body. We can't just look at it as a shoulder pain. We have to tackle it as a holistic problem. If you suspect you have a misalignment, or you suspect that there's a shoulder problem that you have and it has not responded to physical therapy, maybe you've even had surgery on it and maybe it hasn't responded. We have all sorts of cases like that where multiple things have been tried and you still have shoulder pain, which can really affect you. It could affect you anything from, if you're athletic, if you want to throw a ball, you may not be able to. If you like lifting weights, you may not be able to. Even, let's just say it's so bad you can't even reach for a jar on a shelf. We need our shoulders working, right? So if you suspect this could be going on for you, I recommend you give my office a call, request a free spinal health screening. We've been offering this to the community for 10 years. In that screening, we'll check, even though it says spinal, we're gonna check your whole body top to bottom. We're gonna look at how the shoulder blade, how it's interacting with your rib cage, what's your pelvis doing, what's your posture pattern, what's your alignment, and of course we'll look at the shoulder too. We're gonna look at it all, top to bottom. So I hope you find that helpful, and I hope we can help you out real soon. Take care, have a great day.